Channel 6 at 11.
An alarming statistic is raising eyebrows all over the country. Hello, everyone. I'm Jenny Montgomery.
And I'm John Hart, in for Brad tonight. Coverage you can count on begins tonight with a new epidemic. The rate of heroin overdoses in the United States has tripled since the year 2000. The Centers for Disease Control calling the drug abuse an epidemic, and that trend has hit the CSRA. Mike Miller digging deeper into the rise of opioid drugs tonight. Mike, live at an abandoned restaurant on Peach Orchard Road in Augusta. Mike.
Well, through this broken window here to my right is proof that there is a heroin problem on the streets of Augusta. When we walked through this building earlier this week, we found dozens of syringes. It's a problem that law enforcement and doctors are seeing more of across the CSRA.
The root of most of our problem is this right here, drugs.
Heroin is on the rise, even right here in the CSRA.
The majority of the patients that we see that are addicted to heroin started on prescription opiates.
Dr. William Jacobs has been studying drug addiction for more than 20 years. At the Bluff Plantation in South Augusta, Dr. Jacobs and other experts are working to treat the disease.
Probably 60% of the patients that I see are using opiates in some form. Most of them are using some heroin.
It's an addiction that no longer happens in just urban areas. Suburban and rural areas are seeing a rise as well.
Over the last decade, the number of males that have become addicted to heroin has increased by 50%, but the number of females has increased by 100%.
According to the CDC, Richmond County has seen a 75% increase in heroin-related overdoses since 2004. In Aiken County, a 59% increase. And shockingly, Glasscock County, Georgia has seen a 197% increase in drug-related deaths.
We're pretty much paralleling the national data. We're not significantly under, we're not significantly over, but it's rising. We have not stemmed the tide at all. We've not turned the corner. And
Dr. Jacobs says the solution to the problem isn't to lock up addicts. He believes doctors need to do better by noticing the signs of addiction and by not overprescribing prescription pills.
Because prevention is the real key here. We certainly have to treat the patients that become addicted, but if you can prevent someone from becoming addicted, you don't have to treat them.
Now, if you or someone you know is or has been affected by heroin addiction and you want to share your story with us about how bad this drug truly is, you can contact me at mmiller3@wjbf.com. You can also reach out to me on Twitter and or Facebook. Back to you guys in the studio.